I think it's Nat, if I get the name right, talked about a 59-year-old male whose cholesterol was high, was 9.6, and ideally we like it around 5. And the person was taking a statin, which of course is common, plus SEU, which is a great idea, and plasma flow, and was asking about the relationship between the two and in terms of statin and Cerule products. And I think it's a great thing to do together. What I'd like to see happen in this particular case is to, when the statin and Cerule products are taken together, repeat a blood test to check the cholesterol in 3 months. And then if it's lower, try stopping the statin for a while, repeat again in 3 months. And if the levels are normal, then just keep going with the Cerule products. If it's not, then maybe go back on the statin, or maybe just increase the SEU. And I think the person was taking 2 SEU in the day per day. May want to increase that to 4 to 6 per day. So that maybe that'll help get off the statin more easily. So the reason I'm saying this is because I'm on a statin. I have a family history of high cholesterol and heart problems, but I haven't had any. But I'm on a statin, so I'm going to do the same thing. Actually, I'm going to, since I've been on the products for now about a month, I'm going to get my cholesterol checked in another 2 months, and then see if I can get off the statin. So that would be sort of an interesting thing to do, and I think that's something that is very common. Obviously, that statins, there's a definite correlation between Cerule products, spirulina type products, and lowering of cholesterol. We're going to talk about that today as well, and that's how it links together. But thank you very much for that, and the more of these testimonials, obviously, the better.
You mentioned some numbers in there in terms of grams and how much we should take. So you're thinking about 8 capsules a day, and you're doing it yourself. So you're like our own, very own little human guinea pig to see. And so you said 8 capsules, but then you said you're going to retest or test your cholesterol levels in how long?
3 months.
3 months. So would you say to me then as a customer, hey, Andy, you need the Adiponectin connection, you need to take these Cerule products, and you need 8 capsules a day for 3 months, and then get tested again.
Exactly.
Is that your recipe to see if the markers come down?
And that's what I'm doing, and that's what I recommend, because I think that correlates to the studies pretty well. So that it's being supported by independent research, and that study from South Korea, which I think is one of the best studies I've read in the last several weeks regarding these type of products. And so I think it was a very clean study. There's some studies that aren't so clean, meaning there's confusion in the study, they're not that clear, but this was a very clear study. So that data, that correlates basically to 8 SEU a day.
Just give me some concept of the avalanche I'm facing as a diabetic. So just talk me through, once my levels go to the point where I'm deemed a diabetic, what's going on with my pancreas, and what's the future if I don't make any changes?
Yeah, no, that's a good point. So your pancreas, makes insulin. But it turns out that there's obviously connections and communication with all the cells of your body, right? We tend to think of them as separate organs, although they're separate neighborhoods and they don't talk to each other. All the neighborhoods talk to each other all the time in their body. There's a lot of crosstalk, and so that's what makes this sort of challenging. But the good news is that with the way this adiponectin works, and the way that Cerule products will increase that chemical from the fat cells, you're going to have multiple improvements. So without this, and you've got, say you're pre-diabetic and you're not that healthy, your fat cells are getting bigger. Adiponectin is going to drop, which is the good stuff, but the mast cells, the bad cells are going to rise, and then more of them are going to infiltrate or come into the fat cells and have this reaction, this little chaos. And then there's going to be the bad factors that are going to be secreted, the TNF and the interleukin-6 they're called. Those are the bad, that's the bad side. This is the good side. So that's what's happening, and it snowballs. So you get more inflammation, insulin resistance, blood pressure goes up, triglycerides, everything goes up. So that's a snowball effect, and that's why it's a multi-system disease, because it affects pretty well most parts of your body, right? That's why you don't feel so good in general. That's why your energy is less. Lots of things will happen to you. So to reverse that, right, to get to the good side of this equation, of course, diet and exercise is part of this, but taking Cerule products is going to increase your adiponectin quite clearly. And that's going to reverse those things. So you're going to have less inflammation, decrease insulin sensitivity, decrease blood pressure, decrease the blood vessels thickening, lowering triglyceride, drop weight, and drop in the body fat percent. So it's reversing that.
Sounds almost too good to be true. It's like a miracle product we've got here it does.
It's true. Well, that's the thing. That's why I spent so much time, Andy, studying this, because I'm fascinated by it, as you now know, and I just am kind of blown away by the science of all these different people saying the same thing in different countries. They're not like related to each other. They don't have any interest, you know what I mean? So in medicine, we're always like worried that somebody's talking to somebody and there's going to be, there's none of that here. I mean, that's why I thought the Iran study was good. You hardly ever see studies that we do on anybody out of Iran. I mean, it's just not common. So to see that, it made me feel really good about this. And the fact that if we can get myself or all these thousands, millions of other people off of statins, just that alone, or at least lower the statin. Like I'm on 20 a day. If I could even go back to 10 a day, that would be holy grail. If I could come off it, of course, that would be amazing. But the point is, you're going to reduce inflammation. You're going to feel better. But for these reasons, it's not just like I feel better. It's like there's actual science behind this that's supporting Cerule products.